Hello, and welcome to the MIMOSA Matters podcast series. In this series, we will bring you interesting perspectives on the clinical, research, and technological perspectives for near-infrared spectroscopy imaging, or NIRS, and introduce you to MIMOSA Diagnostics. I'm your host, Douglas Queen. Thank you for tuning in and joining us on today's podcast. We will be hearing from Handley, the Regional Director at RestorixHealth in Framingham in Massachusetts in the USA. Christy is a registered nurse with 15 years executive leadership experience. She has held varied positions in ambulatory surgery, physicians' offices, and hospitals. This includes inpatient, OR, ER, and psychiatric leadership positions. Welcome, Christy.
Thank you.
Let me start our conversation by asking you a few questions such that our listeners can get some insight into your experience with NIRS imaging. Tell our listeners a little bit about your clinical practice and experience.
So I am the regional director and I run 15 wound centers, and we use the MIMOSA camera in a couple of them. And so we use the camera for evaluation of wounds, whether they're hyperbaric treated or not hyperbaric treated. And we've been using it for about, almost 2 years now.
Great, thanks. How challenging is the management of various wound types across the many skin tones of your patient population? And do you use a Fitzpatrick scale in your practice?
So yes, we do use the Fitzpatrick scale. And yes, it can be challenging the skin types regardless of the camera or without the camera. So different skin types require different things. Some skin types are oilier or some skin types are drier. And so they require a little different treatment anyway. But with the MIMOSA, we do use the scale. The MIMOSA camera is a little bit different with different skin types, although better than most of the NIRS systems on the market. They are a little bit more, there's more clarity. When using the NIRS system or the MIMOSA camera, you're doing pictures over time. So regardless of the skin type, you're getting the same picture of the same wound time after time after time. And that's how you tell. So there might be a little bit less clarity because of the way that the light bounces or absorbs through different skin types. But you're still going to be able to see time after time what's going to happen with that skin. So it's going to be the same picture because it's the same skin each time you take the picture, and you'll see those differences. So we have a level 5, Fitzpatrick level 5 skin type that we're working on here at one of the centers I work at, and we've taken the picture, and it shows that the wound bed had a lower temperature than the rest of the skin. The peri wound had a decreased oxygenation, tissue oxygenation in the peri wound area, and then the skin around that had normal oxygenation. And so then when you take the picture the next time and the next time, you still get those same type of results. So in other words, as things are starting to heal or things are starting to break down, you'll see that difference as you take those serial pictures. In this case, the tissue oxygenation that was decreased, so we could see that, and that peri wound broke down into wound in the end. So then we watched that over time, and you saw the temperature come back up to normal in the wound bed, and the rest of the peri wound then was normal tissue oxygenation. And then we watched those values get better and better and better as the wound healed.
Great, thanks. And how important is this ability of NIRS to your practice? And how is the clarity of imaging with MIMOSA across the skin tones?
Perfect. So we need this MIMOSA camera, and the more I use it, the more I like that we have it. You can take a picture. You can only see what that picture shows you. The MIMOSA camera it shows you temperature, it shows you tissue oxygenation, it measures the wound. So it has a number of features. The measurement of the wound, as any nurse who works in wound care will tell you, is huge. It measures the wound for you. So when you take the picture, you've already got that done. Otherwise you're doing it yourself. It's just one extra step, right? So that's really important. Having the ability to read the oxygenation of the tissue around that wound or in that wound bed is huge for wound healing. And most centers that don't have this technology can't see that. What we just recently used the camera for, which was really interesting, was a wound that was healing, looked like it was healing from the outside, but not from the inside. With this technology, we were able to see what was happening underneath the wound. So the scar was healing, but underneath that was not. And we could see then that the tissue oxygenation below that was poor. And so we could see something that the naked eye couldn't see. So it's huge for our practice. And as far as across the skin tones, we use it for all skin tones. We don't even think about that because we know that the technology works across the continuum.
Great, thank you. How has this approach changed the way in which you manage your patients?
It just gives us a little extra knowledge. It gives us a little bit more than we had before. Again, it makes our treatment plan a little easier just when we're taking the pictures and we already have measurements. That's really nice. But having the ability to see that, as I spoke about earlier, the tissue oxygenation and that peri wound, knowing that that was going to break down next, we could care for that skin in a little different way. So having that below the surface knowledge, what the eye, what does Dr. Cross say, what the naked eye can't see kind of thing, gives you just a little bit more information so that you can heal patients. And again, when you're dealing with an insurance company and you're sending them a picture of what looks like it's healed or what looks like it's a certain size, and you can show what's going on underneath, you can get the insurance company to listen, and maybe you can dive a patient HBO, or different treatments will be approved because they can see that underneath is not healing. It's going to break down further if you're not careful.
Great, thank you. And would you recommend this approach to your clinical colleagues with a diverse patient population?
Definitely. And I do. I'm a regional director, so I have 15 sites, and I'm consistently bringing this technology to the table for their docs to take a look at, because I think it's really important. I find the vascular surgeons really love the technology as I introduce it to them. And yeah, I recommend it all the time. And I would never say this is not good for a diverse population. We use it across the continuum here.
Excellent. Well, thank you, Christy.
You're most welcome. Thanks for having me.
Thank you, Christy, for giving our listeners an in-depth insight into NIRS imaging, MIMOSA Pro, and its utility in clinical practice. Well, that's our podcast for today. We hope you gained some new perspectives on NIRS imaging and its utility in wound management. Be sure to visit Mimosa Diagnostics at www.mimosadiagnostics.com and visit our social media channels. Add your comments and learnings. We want to hear from you.